In numbers that matter this evening, Uganda seems just like the rest of the continent headed for times that are tough after the United States Agency for International Development, USAID, announced an immediate freeze to all new funding obligations, spending its multi-year $1.5 billion development portfolio. The move, which is in line with President Donald Trump's executive order to re-evaluate and realign U.S. foreign aid, places Uganda's development progress at a significant risk. With the fiscal year 2023 budget of United States dollars $458 million, including emergency assistance, USAID Uganda is one of the largest missions within USAID's Africa Bureau. Its programs that support critical sectors such as health, agriculture, education, biodiversity, energy, and democratic governance, all of which are now uncertain as the funding freeze takes effect. Tonight, we take a deep dive into what the mission has been supporting in Uganda's health sector. The United States is Uganda's largest single donor of health aid, with USAID leading efforts to combat HIV/AIDS, tuberculosis, malaria, maternal and child health challenges. So let's look at the programs supported by USAID in health, HIV/AIDS fight. You're talking $1.49 million. That's the latest data, where approximately 1.49 million people are living with HIV. One of the 1.49 million people, 490,000 90,000 it is, I beg your pardon there, adult men living with HIV, 910,000 adult women, while 72,000 are children living with HIV. Yet the number of new infections stands at 38,000. That's the breakdown. Yes, that's the figure I was looking for. With Uganda's target to eliminating new HIV infections by 2030, and the freeze also in the picture, there could be a disruption. The treatment programs under PEPFAR, which serve hundreds of thousands of Ugandans, with intention to meet the 95 targets. Under these, 92% know their status, 90% received antiretroviral therapy, and 94% virally suppressed. Now, we move over to programs supported by USAID in health. The fight against malaria. According to the World Health Organization, Uganda has the world's largest malaria incidence rate of 478 cases per 1,000 population per year. That's scandalous. It is also the leading cause of sickness and death in Uganda, and is responsible for up to 40% of all outpatient visits, 25% of hospital admissions, and 14% of all hospital deaths. That's the catastrophe that the mosquito is. The malaria death rate in Uganda is estimated to be between 70,000 and 100,000 deaths per year, a toll that exceeds that of HIV/AIDS. The country reports 12 million malaria cases each year, ranking its third globally in malaria burden. Malaria accounts for about 34% of outpatient visits and 37% of hospital admissions. That shows you the burden that it is. Uganda loses over 13 people daily due to malaria. Yes, 13. And this is 2025. Now, programs supported by USAID in health, tuberculosis fight is where we move. Uganda ranks among the top 30 countries worldwide with a significant number of TB, that's tuberculosis cases, resulting in a daily mortality rate of approximately 30 individuals. HIV/AIDS funding estimates by government. When you look at the source of funding for the fight against HIV, with estimates that were done by the HIV department and the Ministry of Health in 2023, 14% of funding comes from government sources, providing crucial support for national HIV programs. 5.4% of funding comes from private, non-out-of-pocket sources, including philanthropic organizations and corporate donations. A significant, that's the figure there, 80.9% of funding comes from PEPFAR, and you're talking the U.S. President's emergency plan for AIDS relief and other international partners. With all the cards, how is Uganda then planning to move forward? Let's hear from the Permanent Secretary of the Ministry of Health, Dr. Diana Twine in there.
Uganda government provides budget to run our health services. The partners come and supplement. Not only just the US government, but we have also other global initiatives. We have Global Fund, we have Gavi, they are there, they have not stopped. But also, this also gives us opportunity to sit on the table, and this is what we are discussing this morning with them, to sit on the table and see what are the critical activities which we cannot postpone. If they've been funding, then we'll have to come on the table, and this is what we are going to do. And in this week, this is my work. This is what I'm going to do, and we analyze in depth, and then we engage finance, and we engage the broader government to see some of those critical the areas that are possibly going to be affected. Then government must come in and bridge that bridge.